know I have someone that can take care of me even when my companion needs a break, which was
absolutely
amazing.
Absolutely. No, it's a nice, like you said, it's needed, it's necessary for the companion to get that break, recharge, come back, and be ready to go. So I love that you had your boyfriend with you. That's great. Share with us, give me some of the tasks that Jessica. So Jessica was your recovery assistant, and her Instagram. I know you want to share her Instagram.
Yes, it's recovery_plug. So definitely follow her there. She's amazing.
Okay, awesome. So what are some things? I know you mentioned the medication. Other than that, when you mentioned the bath, what occurs during bath time other than a bath?
Yeah, right.
You know what I mean.
Yeah. So I mean, you're kind of also like very scared because like you're just like, I don't know this person, because I mean obviously most of the time, well, I had the pleasure of having Jessie twice. So
how did you get it? Did Jenna coordinate that for you?
I know, right? Let's see what happened. But yeah, so I had her for my first surgery, and then I happened to be able to have her for my second surgery. So in that case, I had a little bit more comfortability with her because I see how amazing she was in her first interaction with me. And but in the first interaction, since we're speaking about not really knowing her and not really knowing how things are going, at first it's really kind of scary because this person is seeing you at your most vulnerable state.
You're vulnerable. You know? Now you're vulnerable. You're in pain. I don't know you, and I'm naked.
Correct.
Not a good combination.
It's not. You're having all the, and then mind you, like I had my own thoughts. Like people come out thinking they're gonna look the way they're gonna get, you know. But you're swollen, you're inflamed, you're bruised, you're probably bleeding. There's a lot of things, and so I already saw that, had that pressure on me, and I'm just like, oh my God, now I have a stranger that I don't know coming to look at me and help me take a shower. But it was very comfortable. She was just like, you know, what do you need help with? She was like, here, use a towel. Put the soap there so that you don't have to directly, you know, rub yourself.
Direct pressure.
Correct. And just be soft. And she would help me with my back area since I couldn't reach it, especially with this surgery, which is my upper body.
It's very hard to do this motion.
Correct.
Impossible, basically.
Yeah, and it was hard. And she was just super sweet and very attentive. And I even had her, like, I even called her because I knew she was with another patient. And I was like, hey, listen, like, take the time that you need. I know you've been back and forth and you've been here, but I am going to wait for you to come help me take a shower. And she was like, oh my God, yes, I'm going to be there as soon as possible. She was super understanding. She didn't even give me like that, oh, what do you mean you need me to help you with? You know, she didn't give me that kind of vibe.
And I think that's so important during the recovery process because first of all, we're sensitive. Once that anesthesia is still in your body and you're feeling sensitive and your hormones are all over the place. So any little incline that you're being an inconvenience to somebody can throw you
That is the word. Inconvenience. You feel like you're an inconvenience.
Yeah, you're suddenly a burden to somebody, especially if you're very independent.
Yes.
So I can imagine that it's just not a good feeling to be in. How many hours of assistance did you receive? I know that you keep saying you got the premium package, but just in case somebody that doesn't know what the premium package is, how many days? I think that equates to 3 days.
Yes, it was 3 days.
So it's 3 days, which do you feel, let me ask you something, do you feel you needed more days, less days?
No, I think that was the right amount of days.
I love to hear that. Okay, so it's the right amount of days. It was perfect for what you had done. Okay. Do you think you could have done this with just Chris, your boyfriend?
No.
I
love you, babe, but no.
No,
it's just because, not like I mentioned a little bit before, not everybody wants, especially maybe people who care about you and love you and support you, they want to be there for you, but they really don't know what they're getting into. Like, hell, you barely know what you're getting into, right?
Yeah.
So, and like I said, you're gonna have your good days, you're gonna have your bad days.
Absolutely.
So, as much as I appreciated that, and I would always be grateful and thankful and blessed that he's in my life, and he tried his best and he did his best. I wouldn't say it's wise to not do it with a professional or to do it with a specialist. With someone who is able to, like you said, certified in knowing what medications to take and how to be kind in the service they're providing and how to basically, you know, just make you feel comfortable in that moment, because sometimes like you're going to be your worst enemy at that time. And what better than to have somebody that knows how to deal with your emotions and your body and your pain all over.
Absolutely. And I think we are better patients with our non-family members.
Yeah.
You can yell at Chris.
I know.
And you can be snappy with
Yes.
him. And you're going to tend to be a little bit more compliant with a healthcare professional, somebody that's, you know, that you're not going to be less likely to lash out at. So yeah, I agree with you. I completely.
That is very true. I think there was probably a couple of times where he was like, you sound a little demanding. And I was just like, I'm not, I promise you. It's just like when I need it done now.
Right, I just need it done now. I'm not demanding, but I need it done now.
Exactly.
I totally get it. So sometimes, because a lot of times people think I can come with my husband, my best friend, they can do it. And I tell people all the time, let your boyfriend stay in the boyfriend zone, your best friend in the friend zone, and they can learn in the process, because post-op education is important.
Yes.
But I don't want them to be your primary caretaker.
Correct.
Because they're going to have a lot of time with you at home, because when you go home with Chris, you couldn't take Jessica home.
I know, I wish.
But when you go home, then Chris's hands are full. So I love that you let him go to the rooftop and enjoy his time. So that is amazing. If you had to give somebody a piece of advice about booking post-op care, other than Choose Med Miami.
I was going to say, could that be the first one?
Choose Med Miami.
Yes.
Would you suggest anything as far as the number of hours? Sometimes there is a 10-hour plan. Would you suggest that? What would be your suggestions as far as that's concerned?
I would always say, based on just my experience for both surgeries, I'm not sure how many hours that is, but 3 days worked out for me very well. And I think that I think I had another friend that had